You've probably heard of Cornwall's COVID-19 Assessment Center. To learn a little bit more about it now, we're joined from the Cornwall Community Hospital, Joanne Sidorchuk. Welcome back, Joanne.
Hi, great to be on the show. Love to tell people about the center.
All right, so we know that it was quite the process to get it going, so maybe we could start right from the very beginning and talk about the partnership between CCH and the Eastern Ontario Health Unit to get this center going.
Yeah, so we were asked by the health unit to open up a center, and we wanted to do it very quickly for obvious reasons. So we got together a team of managers and staff here at the hospital and really had to think about how can we set up the center quite quickly. We needed space and a footprint, and the Community Addiction Mental Health Services were very kind to be able to offer us some of their space. So they had a department that moved along, moved to another area, and we were able to do some kind of move into their space here.
Excellent, and little shout out as well for our techs here at Cogeco as well, who worked very closely with the hospital to get the phone line going. So let's talk a little bit about that about the process. So the minute that somebody calls that number, what's the process in terms of intake?
Yeah, so somebody calls a number, and just for anybody who wants to know, it's 613-935-7762. And when they call that number, they're going to get our call center. And the call center will take your name and your phone number. And then one of our nurses will call back the person who called in, because that nurse is going to ask a lot of questions and get more understanding of the symptoms people have, answer their questions, and then we'll give them an appointment.
Excellent. So how long can someone expect to wait for an appointment, roughly?
Our appointments are same day. Some people come in within an hour if they live nearby. Some people maybe take an hour or two to get here, or some may ask for the appointment the next day. So unless you call near the end of the day, then most people are seen same day if that's what they like.
That's excellent. All right, so now let's talk about the process once someone arrives at the center and what that looks like.
Yeah, so when somebody arrives, when they come to the Cornwall Community Hospital, you park in P2, which is the emergency department parking lot. Our gates are open because we don't want people to have to pay for parking and to touch any of the equipment to get your parking pass. And there's a big sign that shows where to come for parking here at the center. There's a sign that shows which door to come into. We're located in the Community Addiction Mental Health Building. When people arrive, there's very rarely a lineup at all because we do schedule our appointments. So we schedule people about 15 minutes apart. Everybody will be greeted by somebody at the door who will instruct them to use hand sanitizer, and if they didn't bring their own mask, to put on one of our masks. We ask people to come in with very few items, so don't bring your children, don't bring your dog, don't bring big purses or big coats, because we want the public to not touch as many things as possible just to keep everybody safe. When you come in, to have your health card in hand, you go up to the registration desk, and there's large plexiglass between the registration desk and the person, and you have to actually put your health card up against the plexiglass and try to talk really loud. It's one of the challenges, especially with people wearing masks and plexiglass. So it's something I think we all need to get used to, is really talking loud. And then they're registered just as if they're coming to the hospital. At that time, they'll be asked to wait in the waiting room. We have 3 chairs, very spread out, and there's rarely anybody in the waiting room. And the wait is well under 5 minutes. When they're called to one of the rooms, then a nurse will come and escort the person into the room. And at that time, then they do receive a bit of an assessment.
All right, and when you talk about that assessment, I know you have some props nearby as well. So what can people expect from the test itself?
Yeah, so in our assessment center, we do have nurses and we do have a physician as well, because we want to make sure that we're hearing the symptoms people have and that we're doing an assessment to see if people could have symptoms of COVID and to see if maybe they need extra medical help. So we do take everybody's temperature, so along the forehead. We do have, this is called a pulse oximeter. So this, you just put your hand in. So similar, many physicians' offices have this. Put your finger in, and it will give you the level of oxygen in your blood. So you can see, I just set it on there. And then certainly the nurse may ask a few detailed questions. And then there is a swab. And so right now we have throat swabs. So you open up your mouth, and then the swab is put way, way, way in the back. And then some of the cells in the back are picked up on this swab. And then this swab is very carefully handled because we don't want to contaminate it. And we have a courier that comes from Ottawa once a day and picks up all of our swabs. And our swabs go to the lab in Ottawa, to the Eastern Ontario Regional Lab Association lab, which is based out of Chio.
Wow. So once all that is done, how long can someone expect before the results are in, and how are they notified?
Yeah, so results, actually today results came in from yesterday. So 24 to 48 hours. Be mindful that we are open Monday to Friday. So if you're tested on a Friday, you'll hear your results typically on a Monday. Now that can vary. Sometimes it could be up to 3 days. Everybody will get a phone call from one of our nurses or our physician who will talk to them about what the results were, give them some guidance about next steps, and then also what to do if maybe their symptoms get a little bit worse. Also, lab results, your test results are available on the Eastern Ontario Health Unit website. And so I encourage everybody to go to the homepage of the Eastern Ontario Health Unit. And there you'll see a section where it has all the assessment centers. Our phone number is there and a list of all the assessment centers in the area. And also will be another tab will show you where you can get your results online. You need to have your health card in hand because you need your full health card number on the front and you need the number that's on the back of your health card. And as soon as the results are available, when we have them, they are also on the website that you go to. And you know what's really great is we have people who are calling us for testing and they say, my employer wants to see proof that I'm negative. And we can't talk to employers, but we say to the person, go onto your phone, go onto your app, go to your home computer. You can go on, log in, and find your result, and then show your employer that. So that's been quite helpful.
Absolutely. Well, that's all excellent information. And Joanne, on that note, I'd like to thank you so much for joining me and really giving us an in-depth look at what people can expect. If, fingers crossed, hopefully most people won't need to use the assessment center, but it's great that it's there and working in such an efficient and safe manner. So hats off to you and everybody that's working at the assessment center right now. And thank you once again for joining me.
Thank you. And if people have any symptoms, go to the health unit. You'll see that it's a fairly long list of symptoms. Please do not hesitate to come in here. There's very little wait. We'd love to be able to test people.